Tubercular drugs. Okay, anti-tubercular drugs. So what are anti-tubercular drugs? These are the drugs which are used to treat the tubercular disease. Okay, and the tubercular disease is caused by which bacteria? Virus or bacteria? First of all, it is caused by bacteria. So which bacteria? It is Mycobacterium tuberculosis. Okay, like that. Okay. So first of all, we are going to complete anti-tubercular drugs today. Okay. So anti anti-tubercular drugs. First of all, tuberculosis is caused by which bacteria? Tuberculosis is caused by Mycobacterium tuberculosis. Caused by Mycobacterium tuberculosis. So you have to remember that tuberculosis is caused by Mycobacterium tuberculosis. Okay. Next, what is the difference between Mycobacteria and general bacteria? So we are going to see that difference between Mycobacteria and general bacteria. So Mycobacteria. Mycobacterium and general bacteria. So what is the difference between Mycobacterium and general bacteria? First of all, Mycobacterium is also called acid fast bacteria. It is called acid fast bacteria. Acid fast bacteria. Whereas general bacteria are normally gram positive or gram negative bacteria. Gram positive or gram negative bacteria. Next, this Mycobacterium is uh, this Mycobacterium is stained by Zale-Nelson staining. Zale-Nelson staining. Zale-Nelson staining. Whereas normal general bacteria are stained by either gram staining. Gram staining. This is stained by gram staining. Okay. Next, these are aerobic bacteria. Mycobacterium are aerobic bacteria, whereas general bacteria are aerobic plus anaerobic. They are aerobic plus anaerobic bacteria. That means aerobic and anaerobic bacteria. Next, replication takes 16 to 18 hours in Mycobacterium. So replication takes 16 to 18 hours, whereas in the case of general bacteria it varies. It varies. For example, in E. coli, E. coli takes I think 5 minutes. Yes, E. coli 5 minutes. E. coli takes only 5 minutes for its reproduction, okay, or replication. Next, high amount of mycolic acid is present in Mycobacterium. See, this is Mycobacterium. So mycolic acid. Mycolic acid is present in Mycobacterium, whereas in general bacteria, which type of general bacteria cellule is made up of peptidoglycan and peptidoglycan and ticolic acid. Peptidoglycan and ticolic acid. Now, most important point you have to remember: this ticolic acid is absent in gram-negative bacteria. Gram-negative bacteria. It is present in gram-positive molecule. Peptidoglycan is also present in the gram-positive bacteria. Okay. Now, the most important point is that if 100 cases of tuberculosis are caused, if 100 cases of tuberculosis, you have to Note that down. This is important. Out of 100 cases, 75 are lung cancer and 15% are brain. Out of 100 cases, 75% are tuberculosis are caused in lungs, whereas remaining 15% are caused in bone, brain, GIT, and neuron. Should I write it properly? Good. So these are about Mycobacterium and general bacteria difference. Now, in the case of TB, out of 100%, 75% is caused in lungs. So lungs, TB, and remaining 15% are caused in brain, brain, bone, GIT, and neuron. Brain, bone, GIT, and neuron. So you have to remember that information. Out of 100% tuberculosis, only 15% is caused in brain, bone, GIT, and neuron, and remaining 75% are caused in lungs, TB only. Okay. Next, what are the symptoms of tuberculosis? So the most important symptom for tuberculosis is persistent cough for more than 3 weeks. Persistent cough for more than 3 weeks. You have to remember that. Symptoms. The most important symptom for tuberculosis is number 1, persistent cough for more than 3 weeks. Persistent cough for more than 3 weeks. Persistent cough for more than 3 weeks. Early morning cough with sputum. In this, you have to write and you have to remember this persistent cough is early morning cough with sputum. So early morning cough with sputum, and that persistent cough for more than 3 weeks. Next is chest. You can write chest discomfort. Chest discomfort. You can also write breathlessness. You can also write breathlessness. You can also write fever, weight loss. Fever, weight loss, and weakness. Fever, weight loss, and weakness. So the most important symptom for cough is that one only. Persistent cough for more than 3 weeks. In that case, the early morning cough will be with sputum. Early morning cough will be with sputum. And next most important is chest discomfort along with breathlessness. Fever will be also there. Okay. So what are the mode of transmissions? So these are the symptoms of tuberculosis. You have to remember that. Next, what are the mode of transmission? Since tuberculosis is an airborne disease. Tuberculosis is an airborne disease. So mode of transmission will be droplets only. Mode of transmission. So mode of transmission is droplets. It's an airborne disease. You have to remember. Airborne disease. So mode of transmission is droplets. Mode of transmission is droplets. Okay. Next, stages. What are the different stages present in tuberculosis? There are 3 stages present in tuberculosis. Stages of tuberculosis. So how many stages are there? 3 stages. What are these 3 stages? Number 1, when the person will be in contact with the when healthy person will be in contact with the healthy person. That is called exposure phase. Exposure phase, number 1. Number 2 is latent tuberculosis. Second phase is latent tuberculosis, and third phase is infectious tuberculosis or infectious, or you can write active tuberculosis, active TB, or you can also write infectious TB. The most important point that you have to remember here is that in the both first and second phase there will be no symptom present. In the both first and second phase there will be no symptom available. So no symptom. No symptom. Here also no symptom. Okay. And in the third phase, that is active tuberculosis phase or infectious phase, in that phase you will see some symptoms present. And most important symptom will be persistent cough for more than 3 weeks. In this condition the early morning cough will be with sputum, okay, along with that breathlessness and chest pain also, okay, chest discomfort, sometimes fever will be also there, okay. Weight loss is most important, weight loss also. So now we are going to see the first phase, that is exposure phase. In exposure phase what's happen, then we will see latent phase, then we will see active phase, okay. So let's go to the first exposure phase, okay. So number one phase is exposure phase. In that condition what will happen, healthy subject will be exposed to the infected subject. In that condition what will happen, healthy object, not object, healthy subject will be exposed to the infected subject. This is the phase 1, exposure phase. In that phase what will happen, healthy subject will be exposed to the infected subject. And already I mentioned just few minutes ago, in that phase there will be no symptom seen, no symptom, okay. Next, skin test, Montauk's test and tuberculin test all will be negative. So negative test. What are the different types of test? They are skin test, second is Montauk's test, and the third one tuberculin test. So skin test, Montauk's test, tuberculin test all will be negative, okay. And you can also see that chest and blood test also, chest x-ray also negative, chest x-ray also negative. Then you can see blood test, it will also be negative. In which phase? It will be in first phase, that is in exposure phase. So you have to remember, in exposure phase there is no symptom, all the tests are negative, and in that phase what will happen, the healthy subject will be exposed to the infected subject, okay. This is all about phase 1. This is all about phase 1. Next we will see phase 2, that is latent TB. In the case of latent TB, what will happen? The immune system will stop their replication of bacteria and also prevent development of TB disease. In the second phase, what will happen? The immune system will stop their replication of bacteria. So second phase is called latent phase. Latent phase. Should I write properly? Or are you getting? Okay. Second phase is also called latent phase. In this phase what will happen? The most important point, immune system will stop their replication of bacteria. Immune system will stop their replication of bacteria and also prevent development and also prevent development of TB disease. Okay, so this is the second phase. In that phase, this is also called latent phase, or you can also say it is latent TB, latent tuberculosis. Okay, in that phase, what will happen? The immune system will stop their replication of bacteria and also prevent development of TB disease. So, for sign and symptoms, in that phase also, no symptom will be seen. No symptom will be seen. All the tests will be positive except chest X-ray. Okay, so no symptom. Next, skin and Montox and tuberculin test will be positive. Skin test positive. Montox test positive. Tuberculin test positive. So all are positive except chest X-ray. Blood test also positive. Blood test also positive except for chest X-ray. In chest X-ray, what will happen? Chest X-ray will be positive. So in that, what we will see? In that case, we will see the pleural fluid present in the lungs, surrounding the lungs, around the lungs. You can say around the lungs, pleural fluid will be present. Okay. So presence of this pleural fluid will be present or positive. The remaining all are negative. No symptom will be there. Skin test positive, Montox test positive, tuberculin test positive, blood test positive. All are positive except the X-ray test. Sorry, X-ray test will be negative. In that case, negative. It will be only seen in the third phase. I'm extremely sorry. So X-ray test will be seen in the third phase. In that case, we will see pleural fluid, presence of pleural fluid, and it will be only in third phase, because third phase is the most dangerous phase. Okay, that is called chronic phase. Okay, it is also called active phase, and that is also called infectious phase. Remaining in first phase and second phase, there is no symptom. In first phase, all the tests are negative. In second phase, all the tests are positive except for chest X-ray chest. It will be negative. Okay, next we are proceeding towards the third phase. Okay, in second phase we will give the treatment for latent TB. We will give the drug of choice. So for latent tuberculosis, the drugs which are mainly used are isoniazid and rifampicin. Already isoniazid and rifampicin are the first line drug only, the first line drug for the tuberculosis. So in that we will use isoniazid and rifampicin. So isoniazid will be 300 mg and rifampicin 600 mg. So drugs for latent tuberculosis. So which drug will be used? Isoniazid will be used. Isoniazid plus rifampicin. In this isoniazid and rifampicin, isoniazid will be 300 mg and rifampicin will be 600 mg. And it will be used for 3 to 6 months. 600 mg. And this isoniazid 300 mg and rifampicin 600 mg, this dose will be used for 3 to 6 months. So you have to remember, it will be used for 3 to 6 months. Okay. Next we are proceeding towards infectious phase or active tuberculosis phase. That is the third phase. So this is the medication you have to remember. It's very important in the case of latent phase. In the case of latent phase, only one antibiotic rifampicin will be given. That is, it is also directly, this rifampicin is CYP inhibitor, CYP enhancer. Okay, so it will enhance or it will increase the CYP activity, CYP enzyme activity. So I will tell it after a few minutes. Wait a second. In the next topic only I will mention that. So that isoniazid will be 300 mg and rifampicin 600 mg is used in the case of latent phase of the tuberculosis or TB disease. Okay. Next, what is the third phase? Third phase is the infectious phase, or it is also called active tuberculosis phase. So third phase is infectious or active TB. In the third phase, what will be the symptoms? All the symptoms will be present that I have mentioned earlier, that is persistent cough for more than 3 weeks and all these things. So symptoms are present. Symptoms are present. Skin test, Montauk test, tuberculin test, all will be positive. Skin test, Montauk test, next tuberculin test, tuberculin test, all will be positive. Skin test, Montauk test, tuberculin test, all will be positive. A chest X-ray will also be positive. Okay, so chest X-ray will also be positive. That means all the tests will be positive only. Now what is tuberculin test? So in this tuberculin test, what will happen? The purified protein of 0.1 ml will be introduced. Okay. In tuberculin test, 0.1 ml intradermal protein will be introduced in the case of tuberculin test. And what will happen? The purified protein will derivative, the 0.1 ml intradermal will be introduced after 2 to 3 days. After 2 to 3 days, reaction will be observed. So after how many days reaction will be observed? After 2 to 3 days. And what is introduced? That is protein. Which type of protein? Purified protein. Purified protein. Okay. So this is about tuberculin test. Okay. Next, can you please tell me in the chest X-ray what will happen? In the chest X-ray, pleural diffusion will be seen. Pleural diffusion and hilar adenopathy. Hilar adenopathy will be seen. So pleural diffusion means pleural fluid, ultimately liquid from liquid form in lungs. Liquid form in lungs. Okay, so these are the different stages of tuberculosis or TB disease. So what are tuberculosis caused by? Tuberculosis is caused by Mycobacterium tuberculosis. What is the difference between Mycobacterium tuberculosis and normal bacteria? First of all, I have already mentioned earlier, that is Mycobacterium is acid fast bacteria. General bacteria are gram positive and gram negative bacteria. Second, Mycobacterium are stained by Ziehl-Neelsen staining, whereas gram positive and gram negative bacteria are stained by gram staining. Next, Mycobacterium are aerobic bacteria, whereas general bacteria are aerobic and anaerobic bacteria. Next, replication of Mycobacterium takes place in 16 to 18 hours, whereas replication in general bacteria varies. For example, in E. coli, it takes place in 5 minutes. Okay. Next, high amount of mycolic acid is present in Mycobacterium. High amount of mycolic acid is present in the cell wall of Mycobacterium, whereas cell wall of general bacteria are made up of peptidoglycan and teicholic acid. Okay. Next, what I mentioned, that if 100 case of tuberculosis are found, So in that 100 case, 75% case will be in lungs tuberculosis, and next 15% will be brain tuberculosis, bone tuberculosis, GIT tuberculosis, and neuron tuberculosis. So tuberculosis doesn't take place only in lungs. Some people say tuberculosis takes place only in lungs. No, tuberculosis can take place in different part of the body, that is lungs, brain, bone, GIT, and neuron. Okay, next we are proceeding towards the drug of choice. So what are the drug of choice for the treatment of tuberculosis? Okay, next is drug of choice. So what are the drug of choice? See, there are three different classes for tuberculosis drugs. They are first line drug, second line drug, and miscellaneous drug. Okay, so first line drug, first line drugs, second line drugs, and miscellaneous drugs. First line, second line, and miscellaneous. In the first line drug, only 4 drugs are used, that is isoniazid, pyrazinamide, ethambutol, rifampicin. Isoniazid, pyrazinamide, ethambutol, and rifampicin. So isoniazid, it is also called INZ. Isoniazid, pyrazinamide, ethambutol, and rifampicin. Isoniazid, pyrazinamide, ethambutol, and rifampicin. These are the 4 primary drugs. They are the first line drugs. That is, for the treatment of tuberculosis, this drug will be used for the first time. And these are already asked in the NIPER question earlier. NIPER previous year question, you will find that. Okay. Next, what are the second line drugs? Second line drugs are cycloserine, pasa, ethionamide. Cycloserine, pasa. What is pasa? Pasa is para-amino salicylic acid. Para-amino salicylic acid. That is pasa. Next, third is ethionamide. Ethionamide. Then capreomycin. And then aminoglycosides. So what are the examples of aminoglycosides? Example of aminoglycosides are streptomycin, kanamycin, gentamicin. Streptomycin, next gentamicin, next kanamycin. Streptomycin, gentamicin, and kanamycin. Next, what is the miscellaneous drug used in the treatment of tuberculosis? So the miscellaneous drug which are used in the treatment of tuberculosis are bedaquiline, delamanid. So please repeat after me. Bedaquiline, delamanid. Bedaquiline, delamanid, thioacetazone, thiacetazone, linezolid, and macrolides. Thiacetazone, linezolid, and macrolides. You can take a screenshot. This is the main classification for anti-tubercular drugs. Okay. So what are the first line drugs? First line drugs are those drugs which are used primarily for the treatment of tuberculosis. If first line drug is not successful to the treatment of tuberculosis, then second line drug is used, which is along with first line drug. First line drug has most activity and less toxicity, whereas second line drug has more toxicity. Okay, miscellaneous drugs are also used in along with them. Okay, so next we are going to learn about the first line drugs. Okay, what is treatment regimen for the tubercular diseases? There are two different phases, that is intensive phase and continuous phase. Before going to the intensive phase and continuous phase, I want to tell you that according to World Health Organization, according to WHO, this first line drug, according to WHO, the first line drug is used first. Okay, after first line drug, first line following second line or followed by second line drugs for the treatment of tuberculosis. Okay, this is important. Now what are the treatment regimen? So in the treatment regimen there are two phases for the treatment of tuberculosis. One phase is called intensive phase and the second phase is called continuous phase. In intensive phase, the treatment will be given for continued 2 months. In the intensive phase, the treatment will be given for continuous 2 months with more number of dosages and different drugs for the proper safety. Okay, and in the continuous phase, only selected drug will be given and it will be given for 4 to 5 months. So there are two treatment regimen. Treatment regimen. In this treatment regimen, what will happen? There are two steps. There are two steps. The first step is called intensive phase and second phase is called continuous phase. First phase is called intensive phase and second phase is called continuous phase. Let me write on that side. Okay, it will be better. Intensive phase and second phase is called continuous phase. Second phase is called continuous phase. In the intensive phase, more number of drugs will be used and for less duration. Okay, so what are the drugs? Isoniazid, rifampicin, ethambutol, pyrazinamide. All the first line drugs will be used. Isoniazid plus rifampicin plus ethambutol plus pyrazinamide. All will be used. Pyrazinamide. All will be used. Isoniazid will be used 300 mg. Isoniazid 300 mg. Rifampicin 600 mg. Then ethambutol 800 mg. Ethambutol 800 mg. And then pyrazinamide 1000 mg. Okay, and this complete treatment is given for continuous 2 months. The intensive phase treatment is given for continuous 2 months. Okay, next treatment which is given is for 4 to 5 months. That is called continuous phase. Okay, let me write on that side. Continuous phase. This is first phase. This is second phase. It is called continuous phase. And this continue in the continuous phase, which drug will be given? Only isoniazid and rifampicin. Only INH and rifampicin. Okay, this INH will be given 300 mg and rifampicin will be given 600 mg. And this treatment will be given for continuous 4 to 5 months. It is given for continuous 4 to 5 months. So what is the treatment regimen? There are two treatment regimen. First one is intensive phase, then second one is continuous phase. Continuous phase is for 4 to 5 months and intensive phase is for 2 months only. In the intensive phase, more drugs will be given and the drugs are isoniazid, rifampicin, ethambutol, pyrazinamide. In this isoniazid will be 300 mg, rifampicin will be 600 mg, ethambutol will be 800 mg, pyrazinamide will be 1000 mg. Second phase is also called continuous phase. In that phase, isoniazid and rifampicin will be given. Isoniazid will be 300 mg, rifampicin will be 600 mg. Okay, so these are the treatment regimen. This is called treatment regimen. Now we are going towards first line of drugs. So what are the first line drugs? Isoniazid, rifampicin. Now we will see individually each one of the drugs, that is isoniazid, rifampicin, pyrazinamide and all the drugs, ethambutol, step by step. Okay, you can take screenshot, or if you want to write, then pause and write please if you are watching recorded lectures. Okay, so next is isoniazid, first line drug. In that first line drugs, number 1 isoniazid. So isoniazid also mentioned as INH. Okay, and you have to remember that isoniazid is hydrazide of isonicotinic acid. Hydrazide of isonicotinic acid. Okay, next, what is the mechanism of action? So mechanism of action is very simple. It will inhibit the cellular synthesis by inhibiting the mycolic acid synthesis. So isoniazid will inhibit mycolic acid synthesis, which will lead to the inhibition of cellular synthesis. Inhibition of cellular synthesis. Okay, so bactericidal on actively dividing bacteria and bacteriostatic on inactive bacteria. This isoniazid is bactericidal on actively dividing bacteria. It can also act as bactericidal, and it can also act as bacteriostatic. So bactericidal on actively dividing bacteria. and bacteriostatic on inactive bacteria. Bacteriostatic on inactive bacteria. So what are the unwanted effects? The unwanted effect of isoniazid is very important. In that, first one is peripheral neuropathy. First one is peripheral neuropathy due to the inhibition of mycolic acid synthesis. So what will happen? Peripheral neuropathy will be seen, and this peripheral neuropathy is inhibited by pyridoxine. There is vitamin B6. Okay, so unwanted effect of isoniazid. What are the unwanted effects? Number one is peripheral neuropathy. Is it visible or not? It's not visible. Okay, so number one is peripheral neuropathy. Next, hepatotoxicity. Hepatotoxicity. Next, GI disturbances. Next is GI disturbances. Okay, so the most important unwanted effect is peripheral neuropathy, then hepatotoxicity, then GI disturbances. GI disturbances is also little bit common, but that peripheral neuropathy and hepatotoxicity are, this peripheral neuropathy is unique. Okay, in this peripheral neuropathy, it can be inhibited or it can be also treated by using pyridoxine. Pyridoxine means it is vitamin B6. So by using pyridoxine, the peripheral neuropathy can be treated. But this pyridoxine is not used with levodopa. It is not used with levodopa. Okay, you have to remember that. Next, we are going towards the next second drug. Second drug is pyrazinamide. So what is pyrazinamide? Pyrazinamide is a product, and the active drug is pyrazinoic acid. So pyrazinamide is a product. Next is pyrazinamide, and pyrazinamide is a product, whereas the active is after metabolism it will become pyrazinoic acid, which is the active form of pyrazinamide drug. Okay, so next let's write the second. My system is not working well. Yeah. So what is the second drug? Second drug is pyrazinamide. Pyrazinamide. Pyrazinamide is a product, and the active drug is pyrazinoic acid. Pyrazinoic acid. Next, most important, what is the mechanism of action of pyrazinoic acid? It will inhibit the fatty synthesis. So by inhibiting fatty synthesis, what will happen? Fatty acid synthesis in bacteria. By inhibiting fatty synthesis enzyme. Okay. So first of all, product, and it is the active drug. So what is the mechanism of action? The mechanism of action is this drug will inhibit the fatty synthase enzyme. So this fatty synthase enzyme, when it is inhibited, what will happen? Fatty acid synthesis in bacteria will also be inhibited. So after inhibiting fatty synthase enzyme, what will happen? Fatty acid synthesis in bacteria will also be inhibited, which will lead to the inhibition of fatty acid synthesis. So one fatty acid in bacteria. Fatty acid synthesis in bacteria will also be inhibited. Okay. Now, what is the unwanted effect of pyrazinamide? The unwanted effect of pyrazinamide. Actually, I am teaching little bit slow. Why? Because you people are maybe you people are writing. So if you are writing, so that you can write. I am telling like this only. So what is the unwanted effect? The most important unwanted effect is hyperuricemia. Hyperuricemia. Next is anorexia. Anorexia. And next is hepatotoxicity. Next is hepatotoxicity. Out of that, hyperuricemia is important for the point of view of GPAT, NIPAR or NET-PG or any competitive exam. Okay. So these are the unwanted effects. Okay. These are the unwanted effect of pyrazinamide. Next, we will see about the ethambutol drug. Okay. So what is ethambutol? Ethambutol is the first line drug which is used in the treatment of tuberculosis or TB. And what is the mechanism of action of ethambutol? By inhibiting the mycolic acid synthesis only, it will inhibit the cell wall formation or cell wall synthesis in the bacteria. So next, third drug. Third drug is ethambutol. Ethambutol. In this ethambutol, what will happen? Ethambutol mechanism of action. Simply write here. It will inhibit the mycolic acid synthesis. Inhibit. My ink is completed. Inhibit mycolic acid synthesis, which will lead to inhibition of cell wall synthesis. This is one point. Ethambutol can work in two ways. First one is inhibit mycolic acid synthesis, and second one is it also inhibit arabinogalactan synthesis. Arabinogalactan synthesis. So what is the use of that? By using arabinogalactans, glucose polymer, it is a glucose polymer. Okay, which is used in the maintenance of the integrity of the bacterial cell. It is required to maintain the integrity. It is required to maintain the integrity of bacterial cell. Okay, so by inhibiting arabinogalactans and mycolic acid synthesis, ethambutol can also inhibit the growth of the Mycobacterium tuberculosis. Okay, next, what is the unwanted effect? The most important unwanted effect of ethambutol is optic nerve damage. Optic nerve damage. So unwanted effect. Number one is optic nerve damage. Optic nerve damage. Next is optic neuritis. Next is hepatotoxicity. Okay, so optic nerve damage, optic neuritis, and hepatotoxicity. Out of that, the first one is most important for the point of view of competitive exam. That is optic nerve damage. Optic nerve damage. Okay. Next, we will proceed further towards. Next, we will go towards rifampicin. Okay. So, what are rifampicin? It is also a first line drug. Okay. It is also called enasamycin antibiotics. It is also called enasamycin antibiotics. What is the mechanism of action of rifampicin? So, mechanism of action. Simply, it inhibits the RNA polymerase enzyme activation. RNA polymerase enzyme activity, which will lead to the inhibition of functional protein synthesis. And when functional protein is not synthesized in the body, what will happen? The bacterial cell will die. Bacterial cell will die. Bacterial cell die. So this is the function of rifampicin. Okay, what is the unwanted effect? Orange coloration of body fluids is the most important unwanted effect. So let's see the unwanted effect here. Okay. Unwanted effect is orange coloration of body fluid. My blue pen is completed actually. Orange coloration of body fluids. Next, hepatotoxicity. Hepatotoxicity. Next, hypersensitivity. Next is hypersensitivity. And next is GI disturbances. GI disturbances. Okay, so these are the unwanted effect of rifampicin. These are the unwanted effect of rifampicin. What are they? Orange coloration. This is unique for rifampicin only. So orange coloration of body fluids. Orange coloration of body fluids. Next is hepatotoxicity. Next is hypersensitivity. Next is GI disturbances. Orange coloration of body fluids, hepatotoxicity, hypersensitivity, and GI disturbances. Okay. Now, please note down one very important point about rifampicin. That rifampicin is, please note down with red pen. Rifampicin is a strong CYP 450 enzyme inducer. Rifampicin is a strong CYP 450 enzyme inducer. Okay, rifampicin is a strong CYP 450 enzyme inducer. So first line drugs of antitubercular are completed here. Next we will see the second line drug after 10 minutes of break. Okay. Okay. So first line drug completed here. Thank you so much.